It's a great pleasure to welcome a fellow paediatrician, Dr Abigail Whitehouse, who is a senior clinical lecturer in children's environmental health at Queen Mary's and a paediatric respiratory consultant at the Royal London Hospital. And because she's a paediatrician, I think she should have twice as much time as everybody else.
Thank you very much for the kind introduction and for the invite to talk today. I have tweaked the title of my talk slightly, and I think Paul did touch on a few of the reasons why. But hopefully by the end of this we can have a conversation about having these conversations in clinic and in the wider public domain, and also about why it's important to be talking about air pollution on every level. So, I'm going to talk a little bit about what families worry about, and then what they come and ask me in my asthma clinic, and then about how to have these conversations, what we're going to talk about, and how we're going to talk about, well, is there anything we can actually do? And then also bringing that back and thinking about that circle of research and how we can use mechanistic work to inform our clinical practice, but also use our clinical practice to choose what we do next with our research projects. So, what do families worry about? If I ask my patients when they come into clinic about air pollution, they talk about certain things. And where do they get the majority of that information from? The news. Everything that they see comes from the media. They don't have these conversations quite so much. It's not really on the school curriculum, so kids don't really hear about it, although that's starting to change. But you can see here that there is a variety of more worrying, less worrying news stories that come out. So you've got things like areas that are banning their log fires because of air pollution. Toast is more toxic than traffic fumes. I mean, you'd have to have a really bad toaster for that to be an issue, wouldn't you? Or, you know, can think about it. Think about where those particles come from. But that's important for the media because they can make a big bang, they can talk about it, it's something to talk about on the news. But actually it's logical, isn't it? Because if you're burning toast, you can see the smoke and the soot, and that's what you can see. Whereas outside, you can see the cars, but you can't really see the air pollution. More so, we see the things that are affecting health, and I have got Ella's picture there. She appears in pretty much every talk I give about air pollution, and we'll hear from Rosamund later. But also thinking about roast dinners, they're scary. And then things like this one. Hang on, I'm going to try it. There we go. Air pollution can reach the womb, toxic soot particles inside the placenta after being breathed in by pregnant women. I won't tell you which newspaper that came from, but there are other newspapers and other articles where it was put in a much less worrying way or a much less scary way. Because actually, if you start saying toxic soot particles and then you're talking about babies and wounds, I would be petrified if I was a pregnant mother and I read that. Yes, we need to be worried about it, we need to talk about it, but we don't need to be scared. And then there's other things, such as people that are making the tube much safer from air pollution, or a certain pollution that's down there. Experts sharing crucial tips for helping parents shield kids from wood burner air pollution. Well, there's quite a simple one of that. You just don't use the wood burner, or you make sure that what you're using is different. But also think about the pictures that we've got here as well, and this is kind of key. Quite often there would be a buggy here as well with a small child, because that would make it seem like that's where they're getting their pollution exposure. And actually, this is all really scary stuff. And is that what they come in and talk to me about in clinic? Well, actually, no. They talk about traffic because it's in the news. It's in the news a lot at the moment because we're talking about ULEZ. So they want to talk about that. They want to know how to avoid it. They're not so sure about the conversation about not getting rid of their car. Although I quite often have conversations about removing pets from the house if they're exposed to pet dander, and that's one of their triggers. Although you don't want to really get rid of your cat, but sometimes, unfortunately, that's the answer. But possibly getting rid of cars is the answer, but that's a harder conversation. They talk about ventilation because that comes through the news. They talk about, should I open my windows? Should I use an extractor hood? There's some interesting evidence on using extractor hoods because they probably don't work very well. I'm sure Ben's in the audience and he might talk about and school exposures, because a lot of the stuff that we do centres around schools, and there was the piece of work done about 5-10 years ago now, where we looked at all the primary schools and we put that in the news, and you found out that every school in London had pollution levels over the WHO limits, which we all knew, but it wasn't already there. They worry about the indoor air pollution. This is Awab Ishaq, who died in 2020 from mould and damp exposure. What he actually died from was a very bad case of pneumonia with wheeze and bronchoconstriction, but probably one of the key triggers was the state of his house. And this is one of my patients' houses that's full of damp and mould. So they want to tell me about this. And actually their interest in the outdoor air pollution is very limited. So how do you have that conversation? I'm not sure about the makeup of the room. I assume the majority of people in here have seen a health professional at some point, a GP, a doctor, yeah. How long do you see your GP or your doctor for in clinic? 5 minutes, 7 minutes, 10 minutes. I get 30 minutes for a new patient, and that's because I'm a paediatrician and we're allowed to have extra time. Adult medicine, I think, is possibly a bit shorter for a new patient.
20 minutes.
Yeah, so 20 minutes to see a new patient that's been referred to a tertiary level hospital, which means they've already been through their general practitioner, they've already been through secondary care, and then they've come for a really high level discussion about what's causing their asthma or their respiratory illness, and you've got to get that all done in 20 to 30 minutes. That's incredibly difficult to do. So when am I going to bring air pollution into my conversation? Because actually there's lots of other things to talk about. You also have to assess their prior knowledge and their concerns, their expectations, what do they want to know about. They actually just want to know how to treat their asthma. Talking about air pollution is another conversation. And then how do we support that conversation and the development of leaflets and resources and supporting letters? Because it's really important that I don't just tell them about this really scary thing that is the air pollution outside the window, but I tell them something that's useful and helpful. And that's where the problem is. Because we can talk about what the pollution does, like Paul's already told us about, its immediate impacts, its long-term impacts. We can talk about how it has those health effects. So we know that it probably causes asthma, we've talked about that already, we know that it exacerbates it. But how does that impact them on a daily basis is really key, because that's not what they're concerned about. They're concerned about not missing school, not missing nursery. Their parents don't want to miss work because they have to earn a living to be able to look after their children adequately. And then what can we do? So the key thing is that you need to reduce your exposure, but how do you do that? So we can reduce exposures outside by walking down side streets, and we've shown that if you walk down a side street, you can reduce your exposure by about 50%. There's a key issue there though, that if you walk down a side street, it's darker. If you're a child and you're on your own, is it more dangerous? Is there risk? Is walking through a park going to be more risky? Do you have the time to walk down the side street? I mean, most of the time it doesn't take that much longer, but do you have the time to do that? And all these things that need to be added in. So if we're giving that advice, what comes with it? We know that if you move yourself slightly further away from the road, that the deposition of particles can reduce. But does that matter? Is that enough? Is that really reducing how much air pollution we're exposed to? It's difficult to tell. And one of the key issues with any of these questions is the fact that there is no evidence, or there is very little evidence, or it's on a very small scale. And it certainly doesn't look at the health effects. We've had quite a few over the years, what I call natural experiments, and they're normally around the Olympics, because Beijing in particular did it really well. They reduced their air pollution exposure in Beijing during the Olympics because they banned cars, which is good, isn't it? They let them back in afterwards, but what they then were able to do was look at some health effects from those time periods. So they looked at babies that were being born, and we showed that your babies were slightly bigger, they had slightly bigger heads if they were born within that period when they didn't get exposed so much antenatally. But then it all goes away because we bring the cars back. And the same thing happens around each Olympics. So maybe we should just have Olympics all year round, and then we just remove the cars. Because it's the same as when we had the wildfires in Australia. Again, the first time that made it into the news, really, across here, I know there was a slight pandemic starting at the same time, but the first time it made it into the news was when the Australian Open started. And so all these high-level tennis players appeared in Australia and said, I'm not going out there, I'm not playing in that, I can see it. So where's the conversation about it? Indoor, we know that we've shown that if you make some simple changes within the home, you can reduce your exposure. One of those is using a well-serviced extractor fan. You know that that can reduce some particulate matter, but actually we found that the most likely thing was that the kids were being removed from the kitchen during the cooking time, and therefore their exposures went down because they weren't being exposed because they were in a different room. But you can make behavioural changes, you can make some changes inside. But again, the key thing there is ask what questions do they want to ask and how does it impact on their life. We know that the health harms of air pollution, these are the conversations we should be having, and they're all there, and we can use these resources. This is from Clean Air Day this year. These are really helpful for us to explain in simple terms what the health effects of air pollution are, because actually I can talk for 10, 15 minutes in a clinic appointment, but actually it's the leaflet that they walk out with that's most important. And again, the RCPCH report again showed us what the impact specifically on children were. It pulled it all together, all that lovely research, but still didn't really talk about what we do next. So we developed this in conjunction with a collaboration with Global Action Plan, and it's a simple set of what I would call simple things that you can do to reduce your air pollution exposure. We actually use this to teach clinicians about air pollution more than we taught the children about it. So we went out and we were teaching GPs, we taught other clinicians in paediatrics, and currently it's being rolled out in a slightly different form within the adult medicine services at Barts Health. And you can use, this is the stuff that we know that there is some evidence for. So using those quieter roads and paths to keep away from the traffic. My biggest one, which is let's walk and cycle and scoot more. Don't want to see me on a scooter. I did not do well with a scooter, but cycling is really important. But having that conversation about the cars is really key, because we're more than happy to advocate for stopping smoking. And as we've shown already today, Professor Bush showed, we know that it probably has the same impact. So why don't we tell people to not remove their cars? Air text, I like, and that comes back to that Toronto study that actually maybe if we were to use this on a bigger scale, we might be able to have an impact on asthma exacerbations. Car idling, which is always a debatable one, but again, if you turn it off, there's no exhaust fumes coming out of it, therefore the pollution exposure drops. And then we threw in some indoor tips at this point, which is thinking about cleaning products, but there's definitely a lot more to be done there. And then we gave them an air pollution plan and things that they can think about and talk about. The most important one at the top, though, is I will use my medicine that I've been prescribed, because that's actually, unfortunately, still the main key thing. But you can think about, and then the next one is I will treat air pollution the same way I treat other triggers. So think of it that way. Don't think of it as something that you're not in control of, but think of it like you think of pollen and you think of your cat that you really, really don't want to get rid of. So think of it as one of your triggers, and then think about everything else that we can think about outside. And we found that this was really well accepted. It was helpful for starting the conversations, but again, it all comes down to time. We can create leaflets, which are helpful, and they can give us some information. Again, all of these things, though, they're all ones that have a degree of anecdotal evidence, but not necessarily nice, good quality, robust meta-analysis data. Because to do that, you'd have to do it on such a large scale that it's really difficult to get the health data, particularly if we're thinking about children. But at least it's about having a conversation. I realise that this is all green, which is really unfortunate, isn't it? Because this suggests that the whole of London is nice and green. It's not nice and green, it's just that the numbers that are used and that are plugged into it are the ones that are there, they're our guidance, but actually we need to be having conversations that actually show that our levels are above what they should be. But if I was a patient and I saw something that looked like this, it was nice and green, I wouldn't necessarily worry too much. So how does this all inform the research that we're doing? So we've done a series of bits and pieces over the last few years, starting with the ACAP study, which was back in 2014 now, and that was looking at healthy children's sputum. So those samples you saw before in Paul's talk, the macrophages with the black bits in, we went out and we looked at those within London, and you can quite clearly see that any child that attends a higher polluted school had a higher level of those black bits in their sputum. And then we've moved that on, and we've talked much more about teaching air pollution to children, and this is when we went out and we talked about talking and educating children alongside that ACAP study. So in order to recruit patients to clinical studies, it's quite difficult. But if you go out into a school with a workshop, everybody likes to take part in workshop and learn, and that's you're giving something back, and we really enjoyed that. We were able to educate and teach about air pollution. At the same time, recruit healthy kids to a research study, which is really difficult to do, although Jill has done this on a much wider scale than I did back when I did my PhD. But that's how we do this. We need to get people that are not coming into the hospital to be involved and have these conversations. Now we've started talking more about housing and health and mould. And this one, have you heard about air pollution? At the end of an asthma CNS, so those are community specialist nurses, at the end of her consultation, she literally, all she did was say, have you heard about air pollution? Has anyone ever spoken to you about it? Who? Turns out that the only person that had ever spoken about it was her, because we've been doing the education projects about air pollution. But actually that's slightly worrying that there was all these children out there with significant exposures that didn't really know about it. So that's where the next piece of work has come from. We're opening the Barts Charity Children's Environmental Health Clinic later this year, where we're going to not only bring the children in and do all the exposures that we do as part of academic medicine and academic endeavours, but we're also going to see if we can find some little pockets of information that we can give them, but then also use the data that comes from that clinic to inform where we go next, and hopefully have enough patients to possibly look at some of those mitigating factors and prove whether they're useful or not. I think it's crossed. But patients and families, we know that they're exposed to an overwhelming amount of information in the public domain, and quite often we're the ones that have to deal with it in the short term. We have to be able to understand what air pollution is and what it does, and it's part of our job for people that know about air pollution and its health effects to teach this to everybody else around us without being just the person that talks about air pollution all the time. We need to have a pollution conversation as part of all asthma consultations. That's just standard. Nice leaflets and signposting on paediatrics. I like pictures. But the problem is that lack of evidence can be really discouraging for the conversations, because, well, how do you prove that this is going to help? And one of the key questions I get asked is, well, if I move out of London, will that make my asthma better? And that's really difficult, because probably, anecdotally we know, but we can't do a randomised control trial where we send people to live in the countryside. That doesn't happen anymore. It's not World War II when we're not sending children to the country. But that's the kind of level of things that we need to do. That's the amount of children you would have to displace from central London to prove that it brings it down. Or we advocate for the pollution levels to be dropped within central London. And other cities, not just London. And then we need to, and this is my next part, we need to engage with local authorities and policymakers. We have to start conversations, we have to talk about it, we have to not be within our own silo, and we need to, as clinicians and everybody else, advocate for patients and children and their health, and try to prove that actually this is what we need to be doing at this point, and why is important. And that's it from me. Thank you very much.
Thank you.